Morning Edition starts now.
It's known as the silent killer. Osteoporosis develops over many years without pain or discomfort. More than 55% of Americans over the age of 50 have osteoporosis, and more than 80% of those affected are women. People's Health special doctor Kevin Watson joining us now with more on ways to prevent it. Welcome to you.
Thank you.
All right, well, let's talk a little bit about osteoporosis. For those who may not know exactly what it is and what are the symptoms?
So basically, osteoporosis is simply thinning or weakening of the bone. Because of that, there really are no symptoms of osteoporosis. It does not cause pain or any discomfort. Really, the only reason we know if you have osteoporosis is through testing or if you happen to fall and sustain a fracture.
Now, see, I guess that's something, you learn something new every day. I would have thought that this would be a painful condition, but there are really no symptoms. And that's, I would think, what makes it the most scary.
Correct. So a lot of times patients don't know they have the osteoporosis, and it's not until they fall and sustain a hip fracture or wrist fracture that they know they even have it.
Okay, so who's most at risk? Is it older Americans?
Correct. So it's definitely patients or Americans over the age of 55 are definitely most at risk. Definitely more common in women than in men. Certainly smoking, alcohol consumption, thin women tend to be at higher risk than others.
All right, so what eventually causes the bones to kind of deteriorate like this? Is it, you know, much of what people do, or is it just maybe something that kind of crops up, hereditary or anything like that?
So genetics has something to do with the osteoporosis. What happens is our bones are constantly remodeling throughout our life. And what happens as we age, the building up of bone doesn't keep up with the breaking down of bone. And so our body turns over our bone, and they eventually get weaker with time because we're not making enough bone.
It's kind of wild. You know, I never thought of it that way. But what are some of the things we can do to prevent osteoporosis?
So the main things to do are, to try to make sure you get enough calcium and vitamin D. Make sure you maintain a healthy, active lifestyle. Weight-bearing exercises tend to strengthen our bones. Avoiding excessive caffeine or nicotine and alcohol consumption can all help prevent osteoporosis.
How many people do you typically deal with that have osteoporosis, and what are some sort of treatment methods?
So we see osteoporosis patients every day in our clinic, numerous from, as an orthopedic surgeon at Turo, we see a lot from falls and fractures, hip fractures. So the main treatments, if you have just some thinning of the bone, calcium and vitamin D. As you get more severe osteoporosis, there are prescription strength medications like Fosamax, Boniva that can be treated to help prevent the loss of the bone.
Okay, and we're talking about a very concerning situation, especially for elderly. Whenever you hear of a fall among the elderly, it's one of the things that first comes to mind is just the fragility of their bones.
Correct. So definitely we see it more in the elderly population, where young people who fall, they just bounce right back up, where the elderly, they're going to fall and they're going to sustain, hip fractures and wrist fractures and shoulder fractures, spine fractures, where people without osteoporosis would not have those injuries.
All right, well, we appreciate you giving us an update, and really some of the best prevention methods as we age. We appreciate it.
No problem.
All right.